我在学校学华语是第二语文，但是我现在已经忘记了很多，只是普通跟病人讲话，所以假如你有什么毛病，我可以问一下你的病情，其他的我跟你讲，我完全忘记了。Hi, I'm Dr. Paul Anantambaya, and with the Singapore Democratic Party, and I'm here to give you 20 answers to your 20 questions. What is your favorite local dish? Oh, that's easy. Biryani, chicken biryani actually. It looks like more than 20 in here. Who is one person you look up to and why? Again, that's easy. That's my father. He was an endocrinologist, that's a diabetes specialist. He passed away about 9 years ago. And he is somebody who practiced the very highest standards of medicine, and he continued to have a great deal of compassion for his patients. Okay, next question. As a medical professional, what is your assessment of how the COVID-19 situation in Singapore has been handled so far? Now, that's a trick question because I can tell you from the medical professionals' point of view, I think the medical professionals have done a super job. You know, Singaporeans have developed diagnostic tests. We've been involved in clinical trials in terms of treatment of patients. The problem has been with the policymakers. And you know, during SARS, the medical professionals were front and center of the SARS response. For this pandemic, it's been slightly different in that the medical professionals seem to have been in the background to a certain extent. Next question. In the previous election, you spoke Mandarin in one of the rallies. How fluent is your Mandarin and how did you learn to speak it? 差不多，我在学校学华语是第二语文，但是我现在已经忘记了很多。只是普通跟病人讲话，所以假如你有什么毛病，我可以问一下你的病情，其他的我跟你讲，我完全忘记了。What are some policy areas that you're interested in? And that's easy. I'm interested in healthcare and education because that's what I do for a living. Why did you decide to join the SDP? Now that's also relatively easy. The SDP is a well-defined political party. It's got very clear policy positions. It knows where it stands. I knew this would come up. How would you describe your party mate, Chee Soon Juan? Now, Chee Soon Juan is the most passionate person I know. You know, I know some people are really passionate about all kinds of things, but Chee Soon Juan is passionate about democracy, is passionate about, you know, doing the right thing when it comes to the people. What will be your first order of business when you take over the term as president of ISID? ISID is the International Society for Infectious Diseases. And I've just been elected president-elect. So in 2022, I'll be taking over as president of the society. My first order of business is to try and get Singapore universities more involved with low and middle income countries. Have you ever faced professional repercussions from your involvement in opposition politics? And the answer is no. It's an interesting story though, because when I first got involved in opposition politics, I gave a talk at the SDP rally at Boat Quay in 2011. And very soon after that, my immediate boss called me up and he said, "What have you done?" He says, "You know, the CEO is hopping mad." He says, "If I were you, I'd go and look for him before he comes and look for you." So I called up the CEO secretary, who happens to be a friend of mine. I said, "Where's the CEO?" And he said, "Oh, he's at a hand hygiene event." I said, "Great, that's my home ground, hand hygiene." So I went to the hand hygiene event, I talked to the CEO, I said, "Look, you know, we're supposed to be an autonomous university, we're able to speak freely, and it's all a matter of being in the right place at the right time." Okay, this is the one question that gets asked all the time. You agreed with the government's position that masks were not necessary from a medical point of view. What do you think of making it mandatory to wear it out now? Now, let me clarify that. If you are perfectly healthy and the people around you are perfectly healthy, there's no need to wear a mask. The problem is that there's this asymptomatic transmission. And I actually did point that out in February, okay? Go and look it up. Now, unfortunately, right now in Singapore, we have these hidden reservoirs of infection, which the minister talked about. We're getting sporadic cases out in the community, although the majority of them are associated with dormitories. So we have no way of knowing if you're going on the MRT, you're going to be standing next to somebody who tomorrow is going to come down with COVID. And until we reach a situation where there's 0 cases for 28 days, then I think we have no choice. You know, we've got to wear masks. I hate wearing masks. I'm so happy when I reach home I can take off the mask, but when I'm out there I got no choice, I got to wear it. What do you like to do in your free time? Okay, to be honest, I have very little free time. Okay, I mean, you know, I'm trying to do so many different things, but I really like a good book, and if I get a chance, I'd like to sit by a beach, listen to the waves, read a good book, listen to some music. Nothing special, nothing extraordinary. Okay, next question is the $64 million question, and I think all the bookies are listening to this. Given the odds that are stacked against the opposition, do you believe that the SDP can pull off a win? Now, this is the other part about Chee Soon Juan that I think people don't realize, or some people only realize, is that he is the eternal optimist. Okay, I thought I was an optimist, but Sun Chuan is the person who believes that no matter what they throw at us, there's still a good chance that we can finally pull it off. And you know, this is the worst time for the opposition to hold an election. This is right in the middle of a pandemic. People are falling sick left, right, and center. We are not allowed to have rallies. These rallies are actually the only way we can really truly get our message across to a large section of the population. The other thing that we do is we do these large walkabouts where we have 20 people come around to a market. We have large teams going door to door, and we can't do that either because they put a cap of 5 people. And when you've got 5 people, one guy is taking photos, one guy is holding the resources, somebody is giving the directions, it's really tough. So the odds are really, really stacked against us. Okay, this question is related to the earlier one. As a person who wears many hats, how do you achieve a work-life balance? Okay, I'll tell you there are 2 secrets, okay? First secret is to empower the people working with you and to trust them. The other thing is on Sundays, I try not to do anything at all. You know, just having that day of rest really makes a huge difference. It gives you a chance to recharge and do what you need to do. Okay, next question is what work does Marua do? Now, Marua is a remarkable organization. It's Singapore's first human rights organization. So what Marua does is they submit a report on Singapore's compliance with the Universal Declaration of Human Rights. They involve themselves with various groups, with disabled, with marginalized groups, with the poor. And basically, they do some human rights education as well. They work together with the Ministry of Foreign Affairs. What do you think SDP will be able to achieve in this election? As I told you, as an optimist, I hope we're going to win 11 seats, get 11 people into Parliament and really shake up the system. You know, if we had 11 SDP members of Parliament, you can be sure the PAP will be kept on their toes. Okay, next question. Do you consider your work in infectious diseases similar to your work in politics? Why or why not? Now, that's a really good question. And those of you who are in the medical field will know there was a Prussian pathologist by the name of Rudolf Virchow. He's the father of modern pathology. And he actually ran for parliament in Germany against the great Iron Chancellor Bismarck. He argued that medicine is actually politics writ large because he says you're looking at the ills of society and you're trying to devise solutions. You're working with different people. In medicine, we work with scientists, with pharmacists, with nurses. In politics, you work with communities, you work with individuals, and you try and fix the ills of society. Okay, 3 corrective directives were issued to SDP under POFMA. You said this was not an appropriate use of POFMA in this case. Why is that so? Now, we have just submitted our documents for the appeal, so I can't give you any specifics about the case. We are hoping that we'll get a good, favorable outcome from the Court of Appeal. I think our case is pretty solid. What are your thoughts on the government opening up to phase 2? Were we really ready for it? This kind of decision is not a purely medical or scientific decision. It's like everything in medicine, you've got to weigh up the risk versus benefits. You know, Singapore was really suffering during the circuit breaker period. So they had to make a decision at some point in time. So on balance, I think it was probably okay to go ahead with opening up to phase 2 as long as they maintain the surveillance. Final question, which is a really nice summary question. So what is your main motivation for joining politics? And that's easy. I've said this time and time again. I'm basically an activist, and I think this is the thing about SDP. SDP is made up, someone said, not really of members, but of believers. These are people who believe in social justice and equality. And what really drove me into politics was the idea that, you know, you can try and fix a problem medically, but it doesn't make sense if you don't address the underlying societal issues. Every citizen has a right to the basic standard of healthcare and life-saving healthcare. They shouldn't have to sell their home just to pay for their healthcare or to go into debt or face bankruptcy. So that's the reason why I got into politics, because I think Singapore can do better. We have the resources, we have the people, and it's just that we need to get the politics right. Thank you.